Thank you to everyone tuning in today, in person, online, and on the phone. I'm pleased to be back at Queen's Park to table my annual report, especially after so many months of working remotely. I want to acknowledge that this land is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. I'm here to talk to you about the work that my office has done over the past fiscal year to help Ontarians with issues across the public sector. It's important to recognize the gravity of what this province has faced in that time. More than 9,000 Ontarians have died of COVID-19, and almost 550,000 contracted the virus. Every aspect of our public and private sectors has been affected. As we seek to learn and implement lessons from this crisis, we must be mindful of the incredible work and sacrifices of so many across this province. I want to recognize the cooperation and tremendous efforts of public servants at the provincial and local levels, which helped us resolve more than 20,000 complaints this past fiscal year. Alors que nous cherchons à tirer des leçons,
Well, we're trying to learn lessons from this crisis and put them in place. We have to remember the sacrifices of so many people in this province. I would like to recognize the considerable efforts of public servants who have helped us with 20,000 complaints during the last fiscal year.
relied on public services more than ever during this time, but at times also found them complicated and more difficult to access. With directives, plans, policies, and programs constantly evolving in response to the ever-changing state of public health, many turned to us to help them obtain services and information when they felt lost and overwhelmed. The stories outlined in my report are a testament to the many ways in which we serve Ontarians and enhance governance by promoting transparency, fairness, accountability, and a respect for rights. We helped thousands of people get the information they needed and the services they required, all while working remotely, like most of the public service. Les exemples de cas.
The examples in my reports show how we have helped Ontarians. It also shows the way we have improved governance with more transparency, more accountability, equity, and the respect of rights. We have helped thousands of people getting information and services they needed. And all of this while working at a distance, like a lot of people have done.
Inmates in provincial jails, children and youth in care and custody, or Ontarians reliant on social benefits who are unable to reach their caseworkers. Our staff's ability to connect them with the right person was particularly valuable. Or even in the words of one father who sought our help with Ontario work benefits, life-changing. We helped many people sort out issues with the various government, relief, and emergency benefit programs, and also nudged officials of those programs to help applicants who were unfairly denied. Sometimes we simply directed people to information. For example, if they were worried that their health cards or marriage licenses would expire. At other times, we made persistent inquiries with officials at many levels. For example, to help adults with complex special needs who were languishing in hospitals because their placements and supports were delayed by the pandemic. Another important aspect of our work is being proactive and offering guidance to government. For instance, when municipal meetings went virtual for the first time, we put our expertise in open meetings to good use, advising municipalities on how to ensure that their electronic meetings were within the law. Of course, we are well known for our systemic investigations, and we continued with several of those against the backdrop of the pandemic. Last month, the Ministry of Health agreed to all of my recommendations for overhauling its oversight of ambulance services after we published our latest investigative report. So we've had excellent cooperation from that ministry, but also the Ministry of Long-Term Care in our ongoing investigation of the province's oversight of long-term care during the pandemic. We have seen progress and reform at the Landlord and Tenant Board as well. as our investigation into delays there continues. And our 2 new investigations are progressing, one into the closures of 2 youth justice centers in the north, and another into cuts to French language programs at Laurentian University. And I'm pleased to say that in our newest areas of jurisdiction, French language services and children and youth, we have done a great deal to ensure that the rights of Francophones and young people in care are respected. Commissioner Kelly Burke's first annual report and recommendations on improving French language services were well received in December, and she will report in detail on our work in that area later this year. Our Children and Youth Unit has worked tirelessly to ensure that the concerns of young people in care are heard. They participate in meetings every week with senior government and child welfare sector leaders to discuss emerging issues and do regular virtual outreach with kids in care and service providers. They have flagged disturbing complaint trends, such as children's aid societies resorting to calling the police to deal with children in their care. All of these examples demonstrate the value of independent oversight, which brings me to 2 areas where I feel a lack of oversight and action is a disservice to the public: public health units and policing. Public health units, which have played such a huge role in our lives this past year, have no independent oversight. Not only was my office unable to address the complaints we received about them, we could not refer them to the patient ombudsman or anywhere else. For any public body to function effectively, there must be oversight, a complaint mechanism, and a way to have complaints addressed. After a year of protests calling for police reform across North America, I have to note a regrettable lack of progress on my 2016 recommendations to improve police de-escalation training. As well, parts of new policing legislation that would expand my office's oversight over all of the province's police oversight bodies have still not been brought into force. I encourage the government to address these gaps in oversight of police and public health units as part of its efforts to implement lessons learned from the pandemic this year. J'encourage le gouvernement.
I would like to encourage the government to act regarding police oversight and for public units so that we can draw lessons from the pandemic.
Il me fera plaisir de prendre vos questions.
I'll be happy to answer any questions. We'll start with people in the room. So, there hasn't been progress in putting in place your recommendations. Could you specify which recommendations in particular you think should have been put in place but were not? And why? Is it a lack of will? I mean, you've made those recommendations in 2016. The Ombudsman. My 2 key recommendations were that we had a new model for the use of force. It hasn't been modified in decades. It would be essential to give police officers tools when they are facing people in crisis. And secondly, we need training regarding de-escalating situations, because standards are not the same everywhere in the province right now. So I think these are 2 key recommendations that will make a big difference. And we see it in the news. We see situations where people die in their interaction with police forces. And so I would like to encourage strongly the government to act on this front. And it's not only our recommendations. Coroners have also been asking for this for a long time. Justice Tillich has published a report along these lines too. And so we've had a lot of consultations, and now it's time to act. Question? We were discussing with the ministry to see why these haven't been put in place. What reason do they give you? The Ombudsman. When we make recommendations, we set up a committee to study those recommendations, and then there's another committee, another study to put in place these recommendations. And then before we realize, 6 years have passed. So it's a good question. And we're always in communication with the Ministry of the Solicitor General. There's been progress, but the progress is very slow. Question. Regarding the French language services, You have noted last year that there were gaps. We were saying it's the first wave, it's normal, we're in an emergency situation. Now it's a year later, we've had 3 waves. Journalists, among others, have had issues. So why do you think that very often still in the Ministry of Health there are communications that are not in French or badly translated? So why do you think that is? The Ombudsman. If we don't plan to communicate in French, there will be gaps. What I see is that there's been progress made. The Commissioner intervened with a lot of players, and she's obtained results already. If we think about press conferences from the Premier, at some point we managed to get simultaneous interpretation. The Commissioner has had an influence on the independent committee that was reviewing long-term care. So there has been work on the government front regarding French language services and its importance. We need to give them a chance. Question? They recognize it, but there's a lack of planning, so obviously their priorities are not right. The Ombudsman. We're going to keep giving the message that we need to plan more when developing procedures and policies, because if it's not part of the planning, when there will be gaps when we're putting elements in place.
Where your jurisdiction ends in the health field, you can't bring on an investigation to a public health unit. Is that, if you can clarify that? But then at the other time, another ways you can find a number or have an OHIP number extended until a woman gets citizenship.
So we don't have direct oversight over public health units, which are quite often functions of municipalities. We have oversight of the Ministry of Health. So when the Ministry of Health establishes policies and procedures and rolls them out, we can see how well they're working. We can see whether they're fair, whether they're being applied appropriately. But there's nothing in our jurisdiction that gives us oversight of public health units to take complaints about them and interact with them. And the same applies to the patient ombudsman. So, whether it's us, whether it's the patient ombudsman, we're just trying to make the point that it's very important for any administrative body to function effectively and optimally. There should be an oversight mechanism there. That doesn't mean things are going terribly with public health either. They've really done some good work and overcome some big challenges. What we're saying is that we got complaints. People had concerns. People wanted more information. They wanted clearer information. They didn't know where to turn. They turned to us, and we couldn't interact. We didn't have the legislative authority to either let the patient ombudsman handle it or handle it ourselves. And we think that that's something that's worth, that Ontarians deserve, actually, is that kind of oversight. And as we pointed out in our recent systemic investigation into oversight of ambulance services, that was a prime example of what happens when you don't have effective oversight, because then you don't have the necessary policies and procedures in place to respond to people's needs. The policies and procedures in place that are in place are not applied properly, and service suffers, transparency suffers, accountability suffers. So I think any public administrative body should have effective oversight.
Did you have oversight over the LHINs?
We did.
And that has been taken away?
Now it's Ontario Health, and that's going to be part of the ministry, so I think we'll have oversight over that.
So you had oversight over the LHINs and could investigate, but
Correct.
Now they're called public health units,
Correct.
You can't investigate.
Yeah. The jurisdiction does not expand to the policy making, the decision making at the government cabinet level, but once the ministry rolls things out and runs programs, then we have oversight of that.
Then, how many complaints did you have that fell into that area of we can't do anything about it?
In public health, I think it was 87 complaints. related to COVID testing, contact tracing, mask and social distancing guidelines, closure of amenities, access to vaccines, that type of thing. So those are things that people wanted answers for from public health, wanted to perhaps comment on the lack of communication or the lack of clarity in the communication, and we had nowhere to refer that to.
So obviously you want to be able to investigate. Okay, then the whole COVID crisis, everything, do you have the ability to investigate anything that falls under the COVID guidelines, whether it's closing of parks or school grounds, or how does...
Well, it depends who's taking the action and making the decision. You know, our jurisdiction is pretty much the Ontario public sector, so all of the provincial government departments, the municipalities, school boards, universities, those fall within our jurisdiction. So if they make a decision that is COVID related, and if it's not communicated properly, if it's not applied fairly, then we would, in most cases, have jurisdiction.
So the rollout of the vaccines and who got vaccine shots and when and how it was delivered, you have no oversight over that, or do you?
So it depends on what level you're looking at. If the cabinet makes a decision that we're going to use this vaccine and we're going to vaccinate this segment of the population, that's a decision that's beyond the jurisdiction. If they hand that off to the Ministry of Health and say, come up with some guidelines, or municipalities come up with guidelines, that would fall within our jurisdiction. Public health units, not.
Would you like because there's a lot of questions that have arisen from the rollout and all of the regulations and about the shutdown, and can you investigate any of that, and should you?
So I think it all comes back to the theme of this report, which is really you should have effective oversight of public administration in this province. All of the examples of cases that you see in this report would not have been achieved if we did not have oversight and the ability to probe those issues, to take complaints from people, hear how it's impacting them, go back to these ministries, these public sector bodies, these municipalities, and have a conversation with them and say, this is what's happening. Can you explain your decision on this? Would you consider changing it? And, that's part of our track record that we're very proud of. Last year was 62% of our roughly 25,000 complaints were resolved within 2 weeks. This year it's down to 50%, but I attribute that to a number of factors. The fact that a lot of the public service is working from home. We're all working remotely, so things slow down a bit. But I think what this report does is reinforces the need in the public sector for effective oversight.
Would you have a high level, do you have enough cause to have a high level report on the rollout of vaccines?
Well, it's such a complex issue. I mean, you'd have to focus. You'd have to define a scope, and you'd have to look at one aspect of that. You couldn't. I think it's too broad to tackle that general topic, and that's typically what we do. Is we define our issue very narrowly to maximize the impact. Otherwise, you could investigate for years and never get to a conclusion. So there are probably aspects of that we could, and time will tell. Thank you.
Okay, let's go to the phone lines.
Ladies and gentlemen, as a reminder, if you have any questions, please press *1. Your next question comes from Holly Mackenzie-Suter with the Canadian Press. Please go ahead.
Sorry, hi. Thanks for taking my question. I just wanted to ask a little more specifically when you recommend the government does, appoint somebody or somebody to have oversight of public health units, like if you have more specifically an idea of what would be the right fit, because just looking at kind of the complaints that you got, some of them were about amenities and that kind of thing might not be the best fit for the patient ombudsman. So I'm just wondering if you have more thoughts on kind of the direction that should be taken.
Well, that's a policy decision that I will leave up to the government. There's pros and cons for the different models. We have oversight of municipalities, so there would be a connection there to municipalities. The patient ombudsman is more directly involved with health matters. So I really don't have a preference. I leave it up to the government to decide. But I think what is important is that somebody have a role, a mandate to take complaints about public health units, to interact with public health units, to have those discussions, to resolve complaints, and every once in a while, when necessary, to do a systemic investigation.
Yeah, I'm wondering too about, you mentioned that they're not necessarily required to have communications in French, and how much of that came up in the complaints, like how many of those you got in terms of people feeling they didn't have public health information in their language.
Well, it's a very important issue, and the French Language Service Unit did deal with some complaints, and I'm sure the Commissioner's report will have more detail on that eventually. What I can tell you is that the Commissioner was very, very proactive in reaching out to the Chief Medical Officer of Health to reinforce the need for communications in French. I think there was, if I'm not mistaken, there was a memo sent out to the various public health units reminding them of the importance to have timely and accurate communications in French from public health units. So we remain engaged, and I know the Commissioner remains engaged on that issue, and it's of crucial importance. All right, well, thank you, everybody. Je vous souhaite une belle été. Merci.
Have a good summer. Thank you.